subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors Today. I'm delighted to welcome back to the Seniors Today platform, Dr. S P Misra. If you're wondering how welcome back, well, Dr. Misra has been on the Seniors Today platform, not on the Health Live series, but as a contestant in the Seniors Have Talent weekly singing contest that we conduct. And when we were looking at inviting someone this week, we thought it would be good to have him because one, he has been part of the Seniors Today family, and plus he is a leading gastroenterologist and hepatologist, and we haven't really discussed liver care for senior citizens, which is why we decided to have him. So Dr. Misra has a string of degrees. I was just asking him a little while back as to what they mean. So he's done an MD and a DM, and he has an FRCP from London and Edinburgh, and a variety of fellowships. He is a professor and head of Department of Gastroenterology of the MLN Medical College of University of Allahabad. A recipient of multiple awards, Dr. Misra has trained in the United Kingdom, US, Japan, and Australia. He has published over 300 odd times in international journals. A past president of the Society of Gastrointestinal Endoscopy of India. He has also been president and secretary general of the Indian Society of Gastroenterology. Welcome back to Seniors Today, Dr. Misra.
Thank you, Pradeep.
You are perhaps the second doctor we've had from a non-metro, and we've decided to actually invite doctors from across the country. We were looking at more from Bombay and Delhi, essentially, and it's a delight to have you here.
Thank you.
This is a question which I ask all our doctors because it's you all are the best people to advise us. What's the scene of the COVID in your part of the country?
Thankfully, it was very bad, but now thankfully we are getting about 4 or 5 cases a day out of 7,000 tested. Things are much better. I think they are a bit tardy in opening up things, because if at all you want to open the auditoriums and have some concerts, this is the right time. Probably another wave is going to hit us, or the cases will increase. Right now, I think everything should be open, but I think this once bitten, twice shy approach of the government, and I don't blame them for that, rightly so. But I think this is the right time to open up things, and things are much better nowadays. And but we are wearing masks. We are adhering to social distancing. We have been vaccinated, so whatever precautions have to be taken have been taken. Your question about people from North Metro. Oh, I was working at the Mayo Clinic, the top center. Anybody will give his right arm to go there. But I wanted to create a department of gastroenterology here. People were dying. So I came back over here and I didn't go anywhere else. And I put in my own entire earning, whichever I earned throughout my life, into the government hospital, creating the department.
Oh wow!
So that was the reason that brought me here, and I stay in a government accommodation. My wife is still a professor of hepatology, and hopefully I'll be retaining it. And before that, I may be passing away. So I don't need a house, and things are good. And now we have a DM degree. We have a DM degree for last 10 years here. So we are training students, and they're doing very well in life. Most of them have gone into practice because that's very luring and lots of money is there. I chose to be in the government setup, create a department, and I faced all the hurdles from the government and everybody else, but I fought it out. So it has been a satisfying life, in a way.
I'm going to ask you this question, one more COVID question. And I know there are people who kind of get upset when I don't get to the topic of the discussion, but the general impression that one has when you say Uttar Pradesh, oh gosh, there's epidemic everywhere. There's a mismanagement of the situation. Now, what is the reality? Because you are part of a government hospital, so you obviously know what the.
So I tell you, the government hospital did very well. I'm not exaggerating. If I had a relative to be admitted, my relatives who had COVID were admitted in the government sector. The only problem is we are overwhelmed. So if we have a staff of 100 and we can manage about 200, 300 patients, we had 1,000 patients. So the ratio was overwhelming was about 5 to 10 times. And that to severe problems with medical staff. And so it's not only the doctors, it's the paramedical staff, the nursing staff, equipments and everything. But we were doing very well. Things were not that bad as was shown in the papers and the television. The corpses floating and all that, because I know that they are buried in the sand over there for a very long time, and I've seen them earlier too. That was later on brought up in the newspapers. But things were bad. Things were bad. We were getting 2,000 patients a day, 2,000 positive cases a day, and our ICU were full. The entire hospital was converted into COVID hospital, but most of the medicals did very well, and I think the government setups were good, and we didn't have any problem with oxygen supply. No problem at all.
Any word of advice? Most of us, most of the attendees here are senior citizens. Any word of advice? We've been hearing.
So for COVID, the advice is get vaccinated. Any vaccine, whatever you get hold of, but don't put off your mask. Only put off your mask inside your house or with acquaintances who are vaccinated. So the best scenario is a person like me who has got COVID. I didn't get from patients. I got from one of my colleagues who came for a birthday party over here. So a person who has got COVID and recovered and has been vaccinated is very unlikely to catch a virus or give you the virus. So second best is person who have been vaccinated. There you can meet with some distancing, but wear a mask for God's sake if you're out of your house, and be vaccinated. Keep social distancing. So every day I have some guests, but in my drawing room, I'm sitting over here on my sofa. The other sofa is about 2 meters away. So distance has to be maintained. Masks have to be worn despite getting vaccines. Hopefully, right now, the incidence or the prevalence is so low that catching an infection is a rarity rather than a rule.
But we are hearing stories about the rise in Kerala. We are hearing stories about the rise in Maharashtra.
That's the Zika virus which is coming up over there. So unfortunately, what was touted to be the best healthcare system in the country, Kerala, and was doing very well. There were hardly any cases for several weeks and months. Suddenly, it has turned for the worse. I don't know why. There has to be a reason. Kerala has got 4 international airports. Many people are abroad, and probably they're bringing it from there. And somehow, right now, Kerala is the worst faring in the country, even worse than Maharashtra.
Great. Let's keep our fingers crossed.
But in Maharashtra, in Mumbai and Thane, especially Thane, Mumbai, and Pune, things were very bad. Fortunately, things have improved, and I hope things will continue to improve before a third wave hits us. This virus is an RNA virus, so it mutates very fast. DNA viruses don't mutate like hepatitis B, but hepatitis C and COVID is an RNA virus like that. They mutate very fast. So you heard about the Delta virus, Lambda virus, and now we are getting some more viruses. So they will mutate. Probably the vaccines will be effective in most of them. You have to take utmost care getting out of the house. Please wear a mask.
Great, Dr. Misra. So over to you now for the discussion on health, on liver care. Those of you who have questions, please put them in the Q&A tab. And once Dr. Misra finishes his presentation, we will pose it to him. Over to you, Dr. Misra. And if you wanted to share the screen, we could do that.
Can you see my screen?
Yes, yes, doctor.
So I'll be talking about the liver. So just give you a brief overview of the liver. The liver is the most active organ in the body. So it's not the largest. The largest is the bacteria in your gut. There's the microbiota, then the skin, and then the liver. It is the most, weighing solid organ in the body. It's the largest gland in the body, weighing about 1.5 kg. Situated in the right upper quadrant of the abdomen over here. It's covered by a capsule known as a Glissen's capsule. And that is why once there's inflammation, you get pain in the right upper part of the abdomen. It is the most active organ in the body. It has multiple roles. It's a processor, stores and redistributes nutrients, produces bile, synthesizes proteins, detoxifies alcohol and drugs, and processes extra nitrogen. That's very important. It has a big right lobe and a smaller left lobe. Functions are the same. The functions, it's a synthetic function of synthesizing protein, fats, and glucose. Metabolic functions for carbohydrate, fat, protein, and toxins. So it can convert one into the other. If it requires carbohydrate, it will convert fat into carbohydrates. If it requires fat, it will store fat, carbohydrate as fat. Bile secretion, I've already told you, it detoxifies and is protective and has a huge immune function. Synthesizes many biological compounds, carbohydrates, synthesizes, stores, and releases glucose. So once you're not eating something, it will release glycogen as glucose to compensate for the blood glucose. Otherwise, you'll become unconscious. 70% of cholesterol is produced by the liver. It degrades as well as synthesizes fats. Proteins, almost all proteins except immunoglobulins are made in the liver. You can imagine the function the liver plays. It synthesizes enzymes and clotting factors. It detoxifies. So what happens is, once you eat something, all the blood from the gut, that is from small intestine and part of the large intestine, they go straight to the liver. So the first filter is the liver. So anything you are eating or whatever you're consuming from your mouth, whatever problem is, that will first go to the liver, and the liver will filter it, detoxify it, modify it. And therefore, the liver is the gatekeeper, basically. Every substance passes through the liver. It detoxifies drugs and poisons and metabolic products like ammonia, alcohol, and bilirubin. Bilirubin is the pigment which gives you yellow color once you're jaundiced. So basically, this hormonal inactivation of insulin, glucagon, testosterone is the site of erythropoiesis. That is, blood is formed in the fetal phase. When the child is inside the mother, blood is formed even in the liver. So it stores glycogen, proteins, vitamin B12 and vitamin A, iron, and blood. Common liver diseases are basically fatty liver nowadays, accumulation of fat in the liver. The causes include alcoholic liver disease, alcohol, excess consumption of alcohol, exposure to drugs and toxic metals, obesity, excess weight, diabetes is a common cause. The treatment includes, you have to stop alcohol, lose weight, control blood glucose, and have a healthy lifestyle. Hepatitis, wherever there's itis, means appendicitis, hepatitis, arthritis, means there's inflammation of it. This inflammation of the liver results from any of the factors that causes damage to the liver. It can be virus, can be excessive alcohol, exposure to drugs and toxins and chemicals. So drug-induced hepatitis is a very common phenomenon nowadays. Herbal remedies. Right now, we are seeing patients who they have consumed excess of kadha or giloy, and they come with liver damage. Sometimes it can be fatal. The treatment includes supportive care of bed rest, nutritious diet. Hepatitis B and C needs antiviral agents. And then you need some anti-inflammatory and immunosuppressant drugs. That's basically the domain of the doctor, not for you. But this is the liver in a cirrhotic. It becomes irregular, shrunken. You can see the surface is not smooth. It's an end-stage condition. And if the liver functions are impaired, it can lead to liver cell failure. and the patient may become unconscious. So what to eat basically when this fatty liver diet is monounsaturated fats, green vegetables, oats, proteins, milk you can have. So if you want to have a good liver, you should moderate your alcohol consumption or leave it and keep your liver healthy. You should always get vaccination for hepatitis B, which is available and is very effective. Thank you very much.
Thank you, Doctor, for this presentation. Short and sweet, but I guess it made all the important and valid points. I know you've already spoken about a fatty liver, but we have a question from Dami Santa Maria, who asks for an 80-year-old with a fatty liver, very active, how does one avoid pancreatic acidosis?
Pancreatic acidosis?
Yeah.
Something is wrong. That's not correct. So if somebody is 80 years old and he's getting fatty liver, just don't bother about it. See, two things are there. My philosophy is one should not compromise on the quality of life. So at 80 years, if somebody is enjoying his alcohol, even if he stops alcohol, how long is he going to live? Why spoil the quality of life? So 80s, I'll be more liberal for the patient unless and until he wants it. So basically,
he just added he's never had alcohol in his life.
No, because of obesity, and even some people are very lean and thin. That's known as lean NASH or lean non-alcoholic hepatitis. The condition which is very peculiar to our country. You know, you have to go back to the genesis. Our food intake was very bad earlier, and I have seen starvation. I hope you have not seen it, but I am my mid-60s. I have seen malnutrition because of starvation in my younger days. So for centuries, we were malnourished. The food intake was less. We were vegetarians. Amount of calories was not available. Then the Britishers came, there was famine and all those things. So we have been basically genetically modified to having low intake of food. And suddenly, calories became cheap. We are all eating good diet, and most of us are obese. So that has led to all the problems. That has led to increase in diabetes. And that is why you have lean NASH, people who are thin, but despite that, they have fatty liver. So fatty liver is basically diagnosed on ultrasound nowadays. But sometimes ultrasound may be fallacious. So if they have grade 1, it may not be there. So don't bother about 80-year-old gentleman who has just fatty liver and nothing and doesn't consume alcohol. No problem at all. Not going to affect. See, for a fatty liver to become cirrhosis, it takes about 20-25 years.
Right. We have a question from an anonymous attendee who's asked, how can I keep my liver healthy? What is the best diet to follow for liver health? Some of the stuff that you've already mentioned, but...
Yes, I'll just repeat. Don't take alcohol, only, I mean, in moderation, not excess alcohol. So social drinking is okay, no problem. But if somebody is a teetotaler, benefiting from it, take a vaccine of hepatitis B, because that is one thing which is preventable. And that's still quite common in our country. There's no vaccine for hepatitis C. Then you have to take hepatitis A and E are caused by the waterborne. This is fecal-oral route. So there's contamination with fecal matter in the water. And once there's an, leakage into from the sewage system into the water supplies, you get an epidemic. So you have to have a good supply of water, safe supply of water for preventing A and E, but by and large, they are not fatal and they're not chronic. It can be fatal, but they're not chronic. Take a vaccine for hepatitis B and eat whatever you like. Don't worry about the food. The liver has got enormous reserves. Even if you keep 1/6 there, it will grow back to normal size. But the only thing is once you consume heavy amount of alcohol or have other problems, then that's going to create problems.
And from what age onwards can one have hepatitis B vaccination?
Any age, it's given to the newborn. It's given to the newborn. So if the mother is a carrier, she has hepatitis, if a mother is having hepatitis B, then that child will get a shot of immunoglobulins in one arm and a shot of hepatitis vaccine in the other arm.
Right.
Any age. And if people have not got vaccinated right now, you're talking about 80-year-old gentlemen, that is catch-up vaccination. Please get vaccinated even now.
Right. Doctor, you've mentioned about alcohol harming the liver, and you also mentioned about moderation. So the question that has come in is, what does moderation mean?
Moderation means social drinking, 1 to 2 peg a day can be okay. 1 to 2 peg twice a week will be better. 1 to 2 pegs a week is much better. And if you don't take alcohol, naturally you can't get alcoholic liver disease.
Right. And is there any, I'm sorry, there's too many questions on alcohol, but
no problem.
Are there any special type of alcohol which are friendlier for the liver?
No, it is not type of alcohol. It's not wine or whiskey and your Royal Salute and Black Label or whatever it is. It is the content of alcohol inside. So most of the brands contain 45% alcohol volume by volume. And it is the absolute alcohol content. It should not be more than 100 grams a day. That's for the Western people. For us, I think it is lower because our body weights are lower and we have many other problems. Probably not more than 70, 80 grams a day.
Doctor, there's a question which has come in, which is, I am 60.
But can I have a caveat over here?
Yeah.
So the caveat is basically that even in heavy drinkers, only 10% will develop alcoholic liver disease. They have terrible problems. But who that 10% is, we don't know.
Absolutely. Doctor, the question which is there is that what are the tests that one must conduct to check the liver health and its function?
Routine test basically is not needed, but sometimes you go for a checkup, they have a battery of tests and probably they're making a lot of money from that. Routine test is not needed, but if you think that you have problem, then there's an enzyme known as ALT or AST, that is SGPT, SGOT, which was called earlier, and the bilirubin. And the synthetic function is determined by performance time, that is how well your blood is clotting, and the serum albumin, that is synthetic function. But by and large, you don't require it. If you have problems, your doctor will advise you what tests to be done.
And you mentioned about getting an ultrasonography done for checking the fatty liver, and that's not always accurate.
No, I won't say that's not very accurate, but grade 1 can be, it's an interpretation of the person doing ultrasound. Nothing absolute. So basically, even if you have mild fatty liver disease, it doesn't matter. I'm sure if I and you go for an ultrasound, we'll both be having fatty liver disease. That's not going to cause any problem. I don't have any problems. My enzymes are perfectly normal. I'm perfectly healthy. A bit overweight because of COVID nowadays, but that's not keeping me unwell or doing something to me. There's one more factor known as entity known as fat and healthy. So there are many people who are fat, obese, but they're perfectly healthy. They don't have any problems. They're conducting themselves very well in life, doing very well, but they are obese. So we have a paradox. Nothing is 100% in medical science. So people who are fat, they're healthy. They don't have any problems. Their biochemical parameters are normal. Their functioning is perfectly normal. And there are people who are lean, absolutely, skinny, and they have fatty liver disease and they have problems. So anything can happen. It's a whole spectrum based. By and large, people who have diabetes, who are obese, they develop fatty liver disease.
Doctor, we have a question on fatty liver from Devendra Gada, who asks, how many stages are there of fatty liver?
Also, again, God did not make stages. It doesn't make A, B, C, D. We made A, B, C, D or Kaka, Gaga, 1, 2, 3, 4. So for convenience, they have classified into stage 1, 2, 3, 4, 5%, 15%, more than 15% fat. How do you quantify that? But on ultrasound, they have made grade 1, grade 2, grade 3. no problem. Even grade 3, if you start exercising, cut down on your fat. The only thing is exercise, good exercise, then it will gradually move away. If you have diabetes, please do control the diabetes. Because not only fatty liver disease is the spectrum of things, cardiac disease, obesity, so everything, thyroid, all they go together. So basically, if you have fatty liver disease, that means there's a metabolic syndrome going on, along with diabetes. So you have to control on your diet, have a healthy diet of green leafy vegetables, and exercise is of utmost importance. Just go for a morning walk every day for 45 minutes. That should be good enough.
A question that has come in is, can the liver heal itself?
Yes, I told you the liver has got tremendous potential to heal. Everything, all body parts heal. That's the beauty of the human body. Everything heals by itself. So by and large, if you go to a doctor or get a prescription, most of the diseases heal by themselves. So liver has got enormous potential to heal. Only when there are involved entirely, it does not heal and then requires attention. But I told you, if you surgically incise and keep only 1/6 of the liver, it's going to grow back into normal. And that is why living people donate the liver, half the liver is donated. And the beauty is that the recipient who gets half the liver, that liver goes into full liver. And the donor also, the liver goes into full liver. That's humongous properties to regenerate. That's one of the most regenerating part of the body, except for blood cells.
Doctor, there's a question that has come in, and it says that I'm exceedingly worried since the last week because I read about the harmful effect of giloy. And ever since the COVID pandemic was announced, I have been having a lot of herbal medicines. While I have stopped them now, what can I do?
Please stop it. And if you don't have any problems, you're unlikely to get problems. But if you get problems like with jaundice, you feel weak or exhausted, please get your blood test done, SGPT, SGOT, and bilirubin. If there's a problem, again, I told you the liver has humongous properties to heal. If you just stop the offending agent, be it giloy, be it any Ayurvedic medicine, or be it complementary medicine or alcohol, the liver has got enormous propensity to heal, and you should get normal liver function. Don't worry about it. Just stop it.
Doctor, this is not a question that has come in, but I would like to ask you, you mentioned about Ayurvedic medicines. Now, I would say a good majority of people in India do have some Ayurvedic medicine or the other.
No, that's not, it should not be taken.
And if it's not Ayurvedic medicine, these are, natural herbs that may be there. You put in some haldi, etc. Now, are these, for instance, is haldi doodh something that can be?
Haldi, we have haldi in all our cooking. Any vegetable you cook, we have haldi.
Right.
We're already taking haldi, and the Westerners don't take haldi. Tell me one thing, there's no Ayurveda in the West. Aren't they getting better? I'm not against Ayurveda or something. It should be scientifically studied, unbiased, and then if it is found useful, it should be used. There are many preparations in allopathic medicine which are from herbs and plants. But they have been, and that is why they're expensive. The research if you have 10 molecules going, only one molecule will succeed. So the 9 research has been wasted. That's why things are expensive. We have a drug for spinal dystrophy which is costing 17 crore rupees. Unfortunately, things are expensive because of that. So basically, I won't advise anybody to take these medicines. Complementary, that we call a scam. Complementary and alternative medicines. Maybe Ayurveda, maybe anything else. Herbal medicine. I have seen tremendous amount of damage done because of that. I've seen people dying of that, and they should not have died.
Very strong and direct words there, doctor. But
one more strong word is there. Have you seen any of the top level people, politicians, judges, whatever they can afford, going to an Ayurveda or a homeopathic clinic or going for anything else? They go to AIMS, they go to Medanta, they go abroad. None of them have all these things. Why is it only for our consumption?
Yeah, I guess you have a point, though, you never know. They may still be going, they may be having some side treatments on.
Oh, they may be taking Shilajit or something like that. For that, I don't care about that. But the problem is, I have seen tremendous amount of damage being done because of that. I don't have any grudge against any pets. You just go and read about it on the web. It's available, scientific literature about homeopathy. There have been umpteen number of studies, doesn't work. I'm not for allopathy. Best is living a healthy life. That is where Ayurveda is. Ayurveda was for a healthy life, not for treatment. So the living life, the Ayurveda way is the best thing, because that is how you have a healthy life. But for treatment, tell me one thing. When I wrote that on my Facebook, for Ayurveda, when the Ayurveda people were there, they were making whatever drugs were for individuals, made by themselves, not in a factory. So that does make a difference.
Right. I agree with you. I think my camera has gone off. Right. No, I agree with you. That
I can see a few questions over here.
Yeah, there needs to be some tests done for the medicines. We have a question from Mr. Shankar Chavan, who says, I'm 82 years old. I used to consume alcohol regularly without much problems. Recently, it led to indigestion, even if it was more than 1 or 2 drinks. Please advise.
So get your liver functions done, but I don't think your liver functions will be abnormal. They'll be perfectly normal. This is just part of aging. You're not 18 or 17 nowadays. And gradually with age, these things do crop up. And again, it doesn't crop up with everybody. Most of the people, they can consume good amount of alcohol. But if you're getting problems, please cut down on your alcohol. Have a healthy lifestyle. Go for a morning walk, and things should be fine.
Doctor, there's a question from Katie Dadanchi, who says, Doctor, my maternal uncles both died of liver cancer and pancreatic cancer. Is it hereditary? And what should we do to prevent it? My 45-year-old son has a moderately fatty liver. How should he take care in future?
First, coming to your son, because he's 45 years and he has a long way to go. He should lead a healthy life, exercise, cut down on, if he's an alcoholic, he should cut down on, if he's consuming alcohol, large amounts, he should cut down on the alcohol. Lose weight if he's obese. And for you, many cancers are genetic. And if your maternal uncles have it, have a screening done. Just simple ultrasound will tell you about both the things. And but no need to worry. It's not that it's 100% that if your maternal uncle had it, you will have it. So don't worry about it. But once in a blue moon, that is about 2 years, just get an ultrasound done. And if things will not grow very fast. So if you get it early, probably they can be cured. That's good awareness.
Thanks. Doctor, there's a question about, can you comment on liver cleansing? There are such procedures available in some parts of North India, I've heard of, somebody asks.
They're nonsense. The liver is such a wonderful organ. Sorry, it cleans itself. Doesn't lead to damage. There's nothing like detoxifying the liver. Detoxifying the liver is only don't consume alcohol. Get a hepatitis B vaccine and don't be obese. Go for morning walk. The liver will be absolutely full. See, we are getting livers from dead donors who are dead. Most of the time, the liver is absolutely healthy. The liver is wonderful organ. The only thing is, by our actions, we spoil our liver.
Thank you. Doctor, there's a question about, can blood thinners cause liver diseases?
Yes. Drug-induced hepatitis, I said, sometimes they can cause. There are many types of blood thinners. And see, the problem is if the thing is excreted by the liver, the drug is excreted by the liver, metabolism takes place in the liver and it may damage the liver. So there are many things. Anti-epileptics also can damage it. So many drugs are there which can damage the liver. The list is huge. And for that, you have to ask your doctor if you have any liver problems. They will not be given. There's drugs which are excreted through the kidneys and they damage the kidneys. So you should be knowing about. By and large, they don't. By and large, they don't. But if you consume for a long duration of time, or sometimes even for a short duration of time, in some people, there can be problems.
Right. Doctor, there's a question which is that we don't find too many liver specialists. There are gastroenterologists, but are all gastroenterologists also?
All gastroenterologists are trained in liver. Now we are getting exclusive hepatologists, DM in hepatology at some centers. But I think that may cause some problem because they're not, they won't be qualified for gastroenterology. But all gastroenterologists are, and if it started in 53, before that there was no specialization. So basically, all the MDs were treating liver. But we are now trained in gastroenterology and hepatology. In fact, my department is known as Department of Gastroenterology and Hepatology. And I'm a professor of hepatology in the department and head of department. I treat all gastroenterology and liver problems. So all DM gastroenterology, DNB gastroenterology are hepatologists.
Thank you. Doctor, there is a question from Mr. Trilokinath Dubey, who says, does Astrovastin taken daily for heart have an adverse effect on liver, or can it cause gallbladder stones?
Yes, atorvastatin, so the cholesterol lowering agents, they can affect the liver. And many a time enzymes are elevated very high. I took it for some time and I got both enzyme elevation as well as muscle cramps. So it damages the muscles too. I had to stop it and change to other things, but I'm not taking anymore. It was just given in a jiffy by a cardiologist. I'm off it for 20 years now. No problem with me. But they do cause liver enzyme elevation.
There's a question from Tammy Santamaria, who says, is a swelling under the eyes, is it due to cholesterol?
There's xanthomas over here, but they don't have a direct correlation. There's deposition of fat near the eyes, especially in the canthus over here, in the canthus, near the nose. But that doesn't have a direct correlation with the cholesterol levels.
There's a question from Mahavir Hazare, who says he joined in late and he wants to know about fatty liver. Doctor, Mr. Hazare, we will have the edited video of this as well as the takeaways on Monday, so you can read that. But he says that I am 66, report says slightly fatty liver, taking medicines on diabetes and BP. I take 90 ml liquor once a week. Is there anything that he needs to be careful
Just
about?
enjoy your life. You're 66, my age. Just enjoy your life. You don't have anything to do, sir.
Right. There's a question from Chitra Khandekar, who asks, what causes gallbladder stones?
That's a multi-trillion-dollar question. Nobody knows what causes gallbladder stones. Of course, there are some predisposing factors. Females have more gallstones. Diabetics have more gallstones, because I think the motility of the gallbladder is affected. In females, because of the hormones. Those who have higher fats, they may have gallstones. Then there are conditions in which the red blood cells are degraded very fast. We call it hemolytic anemia. They get a bit of jaundice. There, because of the high bilirubin content, they get bilirubin stone, not cholesterol stones. And there are some conditions like in Pima Indians and all those things who have hereditary problems of getting stones. But what causes stones in vast majority, probably even God doesn't know.
Thank you. We have one last question we have from Nisar Ukabhoy, who says, I'm 78 years old. I'm asthmatic and a teetotaler with a lean constitution, 52.5 kilos. How does one know that he is suffering from a fatty liver or any other liver disease? I have been taking EcoSprint 75 for the past 2 years.
Sir, why are you worried at the age of 78? That worry is worrying me. It's not that you have fatty liver or don't have fatty liver. Just enjoy your life, sir. Whenever we have crossed 60 or something, 65, 70, just bindas, live a good life. Don't worry about it. You will not be having fatty liver because you're lean. You want to know about your fatty liver, just get a ultrasound done. and there you can, the ultrasonologist will tell you whether you have fatty liver or not. But don't have this hangover of whether I have this or not, because that is affecting your quality of life. The quality of life is much more important than getting a disease. Even if you get fatty liver at this age, it's not going to cause any problems, no problem at all in your life.
Doctor, there's one person who had asked a question earlier, but I'm going to ask that. I had asked a question on fatty liver earlier. Now, a fatty liver was detected when I was 26 years old, and now I'm 60.
I told you, it's a benign disease.
Right.
So fatty liver per se is not a problem. So first you'll get a fatty liver, but if it continues and there's a second hit, then you get what is known as non-alcoholic steatohepatitis. There's inflammation, hepatitis again, there's inflammation in the liver. And that can cascade into problems like cirrhosis, liver cancer. Small, minuscule amount of people will get this, not everybody. So probably we are hyping fatty liver too much and we are not living good quality life. So fatty liver per se is not a problem. Fatty liver, if you just want that you don't have fatty liver, you can live it. Exercise. If you have fatty liver, control your diabetes, control your thyroid functions, go for a morning walk, have a good diet, healthy leafy vegetables and all those things, and you should be fine. Fatty liver is totally reversible, 100%, 100% reversible. And per se, fatty liver is not a problem. It's only when you get to the second stage of non-alcoholic steatohepatitis, non-alcoholic, then problems may arise. I don't say it will arise.
Doctor, this is a question that has come in. Are there any side effects of the hepatitis B vaccination?
Hepatitis B vaccination.
Yeah.
Just like the COVID vaccination, you get a sore shoulder for a day or two, but by and large, it's no problem at all. No problem at all. Absolutely safe.
You know, questions about vaccinations we never asked when we were having our own vaccinations in the past, or
smallpox. You can see the scar marks.
But these days people do ask questions. Thank you, Dr. Misra, for.
I have 7 dogs with me, and I'm bitten once in a blue moon, so I always take the vaccine. Earlier we used to have 14 vaccines in the tummy. I have had that too when I was young.
Yeah, same here. Thank you very much, Dr. Misra. There were
my pleasure.
quite a few questions that come in. A lot of them on fatty liver, a lot of them on alcohol, and whether one should have it or not. And I guess, you know, your words on to people who are above 65, 70 years to enjoy life.
Enjoy life.
And don't worry about the fatty liver, etc. is well taken. Thank you very much.
Thank you.
For coming back to our forum once again. I'm sure you would have loved to sing a song for people to do that, but I'll leave it to you because I know I haven't got you prepared for it. But
it was my pleasure and honor to be with you. And I have a good lecture on the quality of life, especially for doctors. And that is true for that. It's titled A Passion Called Life. Someday again, I'll like to be there and tell the seniors. That's why I told them, don't worry about things. We are past 60. We have lived our life. Just enjoy your life, whatever is left over, and don't worry about any disease.
Doctor, there's one person who said that, you know, that Doctor, you're saying about having gotten to 70 and lived our life, but I want to be 100.
No problem. You'll be 100. If you want it, you'll get it. But don't worry about the disease because that's not up to you. How much do you live I can't dictate the terms. But by and large, people are living till 100. My mother was 102 and she left a perfectly healthy life. So that's not a problem. With good nutrition, with so many vaccines available, and especially nutrition, we are living a healthy life. I'm not telling them, please get a checkup. See that things are not happening, but don't have an overhang over it because that affects the quality of life.
Thank you once again,
Dr. Bye-bye.
These words, thank you very much. We will be back with our next session of Health Live at Seniors Today next Saturday at 5 p.m. See you then. Thank you.
Thank you. Bye-bye. Have a nice evening.